Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the histology of the blood. Those who are new to this channel, please consider to subscribe me. We'll start our lesson on the histology of the blood. What is blood? Blood is a fluid form of connective tissue. It is composed of plasma and cells. Plasma is the fluid portion. The blood cells are the erythrocyte, leukocyte, thrombocyte. Erythrocytes are also called red blood cell. Leukocytes are called white blood cell or WBC. These are called RBC. Thrombocytes are also called platelets. So in a blood smear, we'll look at the blood cell. These are the RBCs. These all are the RBCs here. RBCs here. Okay. Okay, so we got the RBCs, and these are the white blood cell, the polymorphonuclear leukocytes, the monocytes, and we have the smallest member. These are the platelets. Okay, we go to the next slide now. Okay, so if we look at the blood cells, so blood cells are these are the RBCs or erythrocyte or red blood cells. These other cells are called white blood cells or WBC, and these small member, small fragments of cell are called the platelets. These are the platelets. So the WBC are again two types, granulocyte and agranulocyte. The granulocyte has granule that takes the dye like that of the neutrophil that take the neutral dye. Eosinophil, they like the eosine dye. We have the basophil, they like the basic dye. The agranulocytes are the monocytes. Monocyte, they contribute they are the precursor for the mononuclear phagocytic system. From monocyte, we'll get the macrophages. And this is another type of agranulocyte. This is the lymphocyte. And lymphocyte has very large nucleus with a very thin rim of cytoplasm. So the RBC has no nucleus, platelet has no nucleus, other cell has nucleus. Okay, so if we study the formed element of the blood, we can separate the formed element of the blood from the fluid portion of the blood by a centrifuge machine, and we can check the hematocrit. Hematocrit is the percentage of the erythrocyte to the entire blood volume here. So the percentage of erythrocyte of the whole blood is called hematocrit. Hematocrit is an important indicator. If it is low, then we have the patient has anemia. Okay, there is the number of RBC may be decreased, hemoglobin amount may be decreased. Okay, we got that. And in the blood, by hematocrit, we can assess the plasma and the red blood cells here. And in between the plasma portion and the red blood cell, we have the buffy coat. This buffy coat contains the leukocytes and platelets. So you get the platelets or thrombocyte, leukocytes. Again, we have the neutrophil, eosinophil, basophil. We have the monocytes and the lymphocytes. These are found in this buffy coat. Okay, and we have the percentage of the cell are not equal, they are different, like that of neutrophil or polymorphonuclear Leukocyte, they are about 50 to 70%. Lymphocyte are around 20 to 40%. Monocyte 2 to 8%. Basophil are very few in number, 0.5 to 1%. Platelet are about 150 to 400,000 per cubic millimeter. These are the fragments of the megakaryocyte. They have no nucleus. Okay, RBC has no nucleus. Platelet has no nucleus. Okay, so we got the blood smear here, and this is the these are the way to produce the blood smear. Okay, just will the blood will follow the slide. Okay, so this is where we'll make the blood smear, and then we stain it and put a cover slip here, and then we look at the blood smear. This is the blood smear, and we are looking at the RBC, a lot of RBC. The central part of the RBC are usually pale. Okay, periphery is thicker and non-pale part. And this is the way it is biconcave to accommodate maximum amount of hemoglobin inside it. Okay, we have also the monocyte here. In this smear, we got the monocyte. We may not get all the cell in one smear, one slide. Okay, suppose basophil is very difficult to get. Here neutrophil is here, and I'm not seeing any of the eosinophils here. Lymphocyte, monocyte, platelets are the fragments of cell. Okay, we've got fragments of cell, the platelets, and the neutrophil is very much distinct because it is multi-lobed nucleus. Okay, so we look at the formed element RBC or red blood cell. They are biconcave shape, like a disc, biconcave, idea to accommodate maximum amount of the hemoglobin. The diameter is 7.5 micron. Okay, thickness in the center is only 0.75 micron. At the periphery is around 2.6 micron. Okay, it may be smaller, we call it microcyte. In case of iron deficiency anemia, it may be a little bit larger, immature, and we call it megaloblastic condition, megaloblast, seen in vitamin B12 and folic acid deficiency. Okay, and this RBC biconcave shape, and it is very much flexible so that it can go through the capillaries very easily. It has the capacity to squeeze and going through the small capillaries. Okay, and they can stack one after one above another, and they make a roller formation, stacking of the RBC. That is that can be done by the RBC. One is on the another one. Okay, so the RBC may be abnormal in many situations. It may be small size, we call it microcyte, due to iron deficiency anemia, maybe large size, we call it megaloblast or macrocyte, that is found in vitamin B12 or folic acid deficiency. We have another genetic problem, the hemoglobin may be defective in some individuals, especially people of African origin, and they have sickle cell anemia. Hemoglobin is not evenly distributed inside the RBC. Rather, under certain situation, it may be hardened. It may make a boat-shaped appearance like this and like this. And this may be a natural protection against the malaria, like the Plasmodium falciparum in Africa. But in case of hypoxia or acidosis, the hemoglobin may be converted into this boat-shaped structure that is very hard, that is not flexible through the capillary, and may be hemolyzed very early. Okay, maybe by the end of 20 days, there may be hemolysis of the sickle cell. Our normal RBC can survive around 120 days. Okay, so we have leukocyte or white blood cell, we have granulocyte, and the agranulocyte. Agranulocyte are the monocyte and lymphocyte, and the neutrophil is the most common and most, its number is more than other white blood cell, and it is very important for phagocytosis of the bacteria. Eosinophil is also very important in case of helminthic infection. Basophil is associated with some type of allergic reaction. Monocyte is the precursor for the mononuclear phagocytic system. Okay, lymphocytes are associated with immunity, like the humoral immunity or cell-mediated immunity. We have T lymphocyte, B lymphocyte. It is not easy to identify under a light microscope. It is very difficult to say which is T lymphocyte, which is B lymphocyte. But this is lymphocyte. It has very large nucleus with a very small peripheral rim of cytoplasm. This is the monocyte here. Okay, it has kidney shape or C-shaped nucleus. Okay, we have to know that part. The eosinophil take the red dye, that is the eosin dye. Basophil take the basic dye. In between, we have the neutrophil. This is the neutrophil. And we have a lot of diseases associated with the white blood cell. If it is count is low, we call it leukopenia. Count is high, we call it leukocytosis. Okay, leukocytosis may be due to infection, or maybe due to leukemia or blood cancer. Okay, we got that. Now we'll go there. Next slide. Okay, next slide. I will request you to go through this part. This table has been taken from Jankuria's basic histology, and we have to find out the the number of the lobes in the nucleus and function of each of the white blood cells. Okay. Platelets are small disc-shaped, non-nucleated cell fragments derived from megakaryocytes of the bone marrow. And we have to look at the platelets structure. It is here is the microtubule formed by the actin here. We have also open tubular system here. We have the granules, alpha granules, the delta granules. And idea is that it is open tubular system. So when there is any type of blood vessel damage, it may go there and seal it. So it is very essential for homeostasis and prevention of hemorrhage. Okay, so some diseases the platelet may not function properly, that may lead to hemorrhage or bleeding. Okay, so we'll go through the highlights of our slide. Formed element of the blood are the RBC, WBC, platelet are the formed element of the blood. Plasma is the fluid portion of the blood, and it is rich in plasma protein like the albumin, globulin, and fibrinogen. Okay, so when the blood is clotted, then the protein will be consumed by the clot, but will get new protein from the platelets that is added to the to the fluid portion of the blood after blood clot formation. We call it serum. We have plasma protein has very important function like the albumin, globulin. They maintain plasma colored osmotic pressure. They maintain the osmotic pressure of the entire blood, so the blood should not leak out of the blood vessel to the interstitial tissue space. They are also very important to carry the hormones from one part of the body to another part of the body, the nutrients. So a lot of functions of the plasma protein. Sickle cell anemia is anemia due to the point mutation of the hemoglobin. Hemoglobin may not be normally distributed in the RBC. It takes boat shape and pointed portion that may damage the cell membrane. There may be chance of hemolysis maybe within 20 days. Types of leukocyte, we have granulocyte, agranulocyte. Granulocyte are the neutrophil, eosinophil, basophil. Agranulocyte are the monocyte and the lymphocyte. Lymphocyte again two type. One is T lymphocyte, and another is B lymphocyte. T lymphocyte for cell-mediated immunity. B lymphocyte for the humoral immunity. Monocytes are the precursor for the macrophages. They are the contributor to the mononuclear phagocytic system of cells. Platelets are the cell without nucleus with open tubular system, and it is surrounded by the actin, and platelet is very essential for homeostasis. Reticulocytes are the young RBCs with some type of reticulum inside the cell, but they are enucleated. Just they are the cell before maturation. Okay, their count is few percentage in our blood smear. Okay, there if their count is very high, it may be associated with some type of anemia. Band cells are the just premature neutrophils. Okay, band cell also present only a few percentage. Its number indicates there is some type of infection is going on. So again, we'll attempt to find out the smear. Okay, these are the RBC. Its diameter is 7.2 micron. Okay, it is disc shaped. Central part is pale and it is containing less hemoglobin. Hemoglobin is distributed towards the periphery. Okay, so we have the platelet, the fragments of cell, platelet. These are derived from the megakaryocyte. I'm saying the WBC here, one WBC, another WBC, another WBC. So this may be the neutrophil here, and it may be the basophil with high magnification. We may be confirm that part, but if we have multiple lobe, it takes the neutral dye, then it is neutrophil. Okay, and that's all about the histology of the blood. If you like my video, please support my channel. Please subscribe me, share the information with your friends, and any question, please feel free to ask me. Have a nice day. Bye now.